everyone, and thank you so much for joining the NeedyMed special topic webinar, Making Medications Affordable, presented by our partner, RX Outreach. My name's Carla. Hi, everybody. I'm the Director of User Engagement at NeedyMeds, and before we get started, I'm going to offer a few tips so you can make the most out of today's presentation. First of all, if you do have questions, you can type them at any time into the questions section. For some of you, it may be the chat section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the time to answer your question, we'll follow up with you by email. But of course, we will provide the contact information for our organizations, both NeedyMeds and RX Outreach, at the end. This webinar is being recorded and will be available on the NeedyMeds YouTube channel, which I hope you subscribe to. And go ahead and check out that handout section of your GoToWebinar control panel. That's where we uploaded materials we thought you'd be interested in. So let's get started with what NeedyMeds is. For those not yet familiar with us, what you're looking at on our screen is our mission statement. But simply put, we connect people to healthcare savings programs. And we do that free and anonymously through our toll-free helpline, 1-800-503-6897, and our website, needymeds.org. I like to put up a screenshot of our current homepage because our website is the face of our organization. And it gives me a chance to point out a few things, such as if you are looking for healthcare savings resources, go ahead and click on the aptly named Healthcare Savings tab. Right next to that is the Education tab. This is where you can find other upcoming webinars. You can sign up for our newsletters or program alert emails. So check that out when time allows. Also, on the top right hand, where that box just popped up, is a link to the NeedyMeds YouTube icon. As you can see, it's with the rest of the social media icons. I think it's the third one from the left. So as I said, we do hope that you subscribe. That way, you will be notified when all new webinars, videos, and presentations are uploaded, so you won't ever have to miss out on anything. I also mentioned that you can find upcoming webinars under that Education tab. Well, you can also find them on the calendar of events, which is on the bottom right hand of our website. So check that out. So as you saw, a big part of NeedyMed's mission is education. And we define that, of course, by educating people about NeedyMeds and the resources we have. But we also fulfill that education part of our mission by educating our users about other ways to save on healthcare expenses. And that's why we're so proud to have a representative from RX Outreach share the important work that they do. So first, let me tell you a little bit about RX Outreach. They are actually the nation's largest nonprofit, fully licensed digital pharmacy. They offer more than 1,000 medication strengths at affordable prices. Mission to provide affordable medication to the underserved, RX Outreach partners with hundreds of clinics and organizations such as NeedyMeds across the U.S. to provide a crucial health safety net for those who battle both illness and poverty. Since 2010, RX Outreach has served over 450,000 people and helped them save more than $880 million on their prescription meds compared to retail costs. And I say this every time we're lucky enough to have a presenter from RX Outreach join us, which is that I am always surprised by those numbers, that they have actually to date served over 450,000 people and help them save more than $880 million on their prescription medications compared to retail costs. I always have to repeat those numbers because they startle me. So now let me tell you a little bit about our guest and my Phil, who's going to walk you through a little bit more about RX Outreach and how they can help you, your patients, your clients, and your loved ones. So, Bill Vatterott is the Director of Marketing and Programs at RX Outreach. And I always say that that title doesn't quite cover the extent of what he does, and it certainly doesn't cover his passion for helping people. Bill has worked in nonprofits for over 25 years, including the last 6.5 years, and we may be coming on closer to 7 years at RX Outreach. Bill graduated from Catholic University in Washington, D.C., and later earned master's degrees in theology and in divinity from Kendrick School of Theology. He also completed his doctoral work and passed the comps in educational leadership at St. Louis University. I think both his professional and academic experience speak to his dedication to helping people and truly making a difference in their lives. We are so proud and pleased to have his partnership and are grateful that he's taking time out of his day to share his expertise with the Needy Meds audience. So, without further ado, and hopefully, fingers crossed seamlessly, I'm going to go ahead and pass my mic and the screen to Bill. So just bear with me. And Bill, you should be able to grab the screen now. And as he does that, I will remind everybody that if you do have questions for him, perfect, Bill, I can see your screen in PowerPoint mode. If you do have questions for Bill, don't hesitate to type them in to that questions or chat section of your GoToWebinar control panel, and we'll do our best to get to as many as possible at the end of the presentation. And with that, I'll pass the mic to Bill. Thanks, everybody, and enjoy the presentation.
Hi, everybody. Thank you very much for the kind introduction, Carla, and to Needy Meds for being such a wonderful partner. I really come to enjoy these webinars because so many wonderful partnerships have come about because of them, whether it's with an individual patient or with a community partner as kind of part of this healthcare safety net. It is a real honor to be with everyone today. I'd like to say for the very beginning, as a nonprofit pharmacy, and really any nonprofit, our goal is not to exist. We we want to solve the problem for which we were created. That should be the point of any nonprofit. So for us, it's affordable medication. And even though more people have access to insurance than ever before in the United States, this is still a huge problem. And so I want to thank you for being here, whether you are an advocate, a caretaker, taking care of an elderly parent, a patient, whether you're from a disease state organization, a doctor's office, a clinic, whatever place you are, thank you for being here and caring enough to help us solve this problem. We want to be able to support you and help you. I want to start off just sharing a letter. Um, this is from one of our patients, and I think it speaks to the impact that RX Outreach has. We're different from a lot of other pharmacies. And I wanted just to direct your attention to the second to last paragraph. And this is from a patient whose husband had just passed away. He also was a patient. And one of the things that RX Outreach does is we write handwritten condolence letters to the families of our patients when they pass. We have 30, 40,000 patients a year. So we really care about our patients, but we want to make sure that we're praying for them and expressing our condolences. And as you can see, this wonderful woman wrote, I have to tell you that you are directly responsible for a few of the extra years we had together. There was no way we could have afforded full price for his meds. So I want to thank you very much for the affordable meds. The words on the top of your prescription bottle pretty much say it all, honoring God by serving others. So I wanted to share that because we are different. And I hope that by the end of the presentation today, you understand that we just don't have the corporate efficiency of a national nonprofit, but we also have that charitable heart because we're all at RX Outreach for that mission. So in today's presentation, I'm just going to give kind of a high level overview of who we are, what we're about, and how you can partner with us, how we can partner with you, some of our special programs and some of the partnerships. And I want to tell you first that we're not here to replace local pharmacies. We work as kind of part of the healthcare space, but we carry chronic medications, so acute medications, are still needed from local pharmacies. And so we know those are special relationships. But the reason that we exist for this is for medication access, but particularly to solve the problem of medication non adherence. I just want to go very briefly over this because I feel like that's a reason why a lot of people are here. Why do people not take their medication? Some people don't take it because they're fearful of the side effects. Maybe they doubt why its effectiveness. It's their attitudes. We had a patient who was nice enough to share a story, and he had a kidney transplant and needed medication to make sure that his body didn't reject his kidney. And he felt fine, so he stopped taking it and needed to get another kidney replacement, another donor, which was fortunate. But his whole attitude about it. Sometimes people don't take their medication as prescribed because it's complex, where they have a lot of medications a day, maybe discomfort with something like a shot with whether it's insulin or needles. Sometimes it's environmental. Maybe somebody has transportation barriers. They can't get to the pharmacy. Maybe it's bad weather, whatever reason. That's one it's one whole area why they don't take their medication. And then lastly, and it's one of the main reasons we exist, is for the cost. Um, 1 out of 4 Americans cannot afford their medication. 1 out of 4, and half of those people have insurance. So we know that this is a huge issue, and that's why we're here. So RX Outreach is a nonprofit pharmacy. We are based in St. Louis and have about 40 employees. We were founded by Express Scripts as an internal program and spun off in 2010 to become a separate 501c3. You can see our mission here and our vision. Express Scripts is now Cigna. We are completely separate from them, but we were spun off so that we could be even more effective and more focused on helping people in need. So RX Outreach, as said by Carla, has had an impact over the last 12 years. Last year, we actually gave away over $200,000 in free medications. We buy most of our medications, about 85%. Some we get donated, and we like to keep our program as simple as possible. So we feel that that's the best way to reach everyone. So in the kind of how we welcome patients, I just want you to keep in mind our focus. We're patient focused. We strive to be transparent, convenient, and we're sustainable. We're a sustainable source of medication. So RX Outreach is fully licensed, and this is really important because we have a lot more online pharmacies nowadays. Not all of them are good. We had one that was an RX Outreach pharmacy, so they said, but they were located in Canada, just a few miles over the border. And we had to kind of squash that because there's a lot of not good players out there, but people are desperate to find the medications that they need to stay healthy. And so we are fully licensed by the National Association of Boards of Pharmacy. So we report to, I think, 40 states every day. We have surprise inspections, so all our medication is safe. We get it from good manufacturers. We purchase it, so it's all on the up and up. We are licensed as a charitable organization by the BBB. Transparency through our pricing and through our model, and then last few years we've been honored to be included as a best online pharmacy with Forbes and with Money Magazine, and we're the only nonprofit pharmacy that's on that list. So we carry about 1,000 medications for 60 or so disease states. This is a downloadable one page that I think is included here that you can look at, or you can download from our website. We also have the ability, you can search our website in the search bar there for a medication. You can search by the generic name, by the health condition, by the brand name, and the price that you see on our website is the price that you pay. That's it. We keep it simple. That includes shipping. So some other places say it's free, but it's actually not. And ours is the price you see is what you get. So we keep it nice and simple. So RX Outreach is all mail order. So we don't accept insurance. Um, Somebody can have insurance, but we don't accept insurance. So that kind of causes delays, and it's the variance of pricing. So our model is out of pocket, um, and we mail to all 50 states, um, the U.S. territories, Puerto Rico, Virgin Islands, and our mail is usually it's about 3 to 6 days for most parts of the country. We like to help patients by sending text reminders and email reminders when they have a refill. One of the great parts about RX Outreach is that you can always call and speak to a pharmacist. So we get about 3,500 phone calls every week, and you can always a patient can always ask to talk to a pharmacist about any medication that we carry or that they're getting from us or any other medication, which is really nice considering how kind of our brick and mortar pharmacists now have to do so much stuff with shots and everything. So it's private and it's convenient, but we always have that, and there's no cost. We have patient friendly hours from 7 a.m. Central to 7 p.m. Central time, Monday through Thursday, and then we're open till 5:30 on Fridays, and then on Saturday. And then we also answer the phone calls in less than 30 seconds, most of our phone calls. We also are sustainable and safe. So a lot of places we know that our clinics and a lot of folks, they go for free first. The only issue is that free runs out. So our supplies won't run out. We do have the state of the art technology. So one of the things we're very proud of is that I think last year, I think we had 18 errors out of 187,000 prescriptions. And so an error could be that it was supposed to go to 123 Main Street, apartment A, and it went to apartment B, or some other thing. We have a 99% accuracy rate, which is higher than retail. So we do keep that safe. And lastly, we have great partnerships. So just to give you an example, Hepatitis B Foundation, a few folks were on from Hep B Foundation a few years ago on this very same webinar. And they reached out to us afterward and said, is there any way that you can add these 4 medications? Because 20% of our phone calls in the first few months of the year have been about the price of these meds. And is there any way you can add these to your drug list, your formulary? So we spoke with them. We ended up adding 3 of the 4 that they asked, and we kept it at a very low price. And then this year we got, well, last year I suppose we got some donations and we got some grants, and we then could offer it for free to everybody. So for the past year, the Hepatitis B Foundation, anyone they sent to us got it for free. So those are the kind of wonderful partnerships we love. And we've just recently become part of Unite Us, which is a national 211. So I share that. If you're a case manager or you're kind of in the nonprofit space, check out Unite Us, because it's a great network where you can do referrals of patients and find resources. So we accept people that earn less than 400% of the federal poverty level. So that's $54,360 a year for an individual and 111 for a family of 4, 111,000. So it's very generous. And what we did is we used to be 300% and to match kind of the federal subsidy for ACA and a lot of the patient assistance programs, we moved it to 400%. Most of our patients earn 200% or so, but we don't ask for verification on that. We do an audit a few times a year, but generally we just ask the person um, to sign or tell us that they earn less than that. We do have expanded still guidelines because of inflation and because of kind of the effects of the pandemic. So if anybody is above those, they can reach out to us and still enroll in our program. So when you consider RX outreach, if a person is spending any of their own money on medication, or if they've exhausted all the other options, and affordability is necessary. So, sometimes somebody may be able to pay for 3 of their meds, but one month they can't pay for another one. Um, for us, it doesn't matter if the person gets 5 meds from us or one. We just want to be able to help. If a person doesn't qualify for a patient assistance program or Medicaid, or really if they don't have the ability, there's a lot of paperwork oftentimes to get the free medication. So if they can get it through us, very simple, it helps save them time, and a lot of effort. If somebody's insured but the co-pays are too high, we see a lot more of that nowadays. We used to not have serve people who didn't have any insurance, and now we see a lot of people who are underinsured, so they can afford some of their medications, but the price just too difficult. It's too high for them. If somebody's undocumented, we serve people regardless of their immigration status. If they have multiple medications, as I mentioned, they face transportation barriers, particularly in the winter months. A lot of people don't want to go out when it's cold, and we deliver directly to their homes. Or if they're a clinic partner, we also can deliver to the clinic. If a person doesn't have the strength of the medication that they need from the pharmacy, or if they just want simplicity. Um, we don't do coupons, we don't have discount codes, secret things like that. We'd like to keep it simple with the price on the website. So to enroll in ARCS Outreach, a patient can be enrolled they can call and they can enroll themselves. They can download one of the forms from the website, but also a clinic or a case worker or an advocate can also enroll a patient. And I'm going to talk about our clinic portal and those programs in just a few minutes. But someone can do online, they can call us, they can download an application and mail it in. There's a number of ways, and we really just need the name, address, and household income to enroll somebody. Some people also, if you want to just submit a prescription, we also then will start the enrollment process, and that can be e-scribed or faxed or mailed. We can't accept it directly from the patient. It has to come from a doctor, although we can call a pharmacy and have a prescription transferred if needed. Upon payment, we send out the medication, and that our turnaround it's less than a day. So as soon as we get a prescription in, we and have payment, we process it and send it out. We also send out refill and renewal reminders to patients, as I mentioned, through phone calls, mails, text, so that somebody, especially before the holidays, will send out an email and said, you may want to order it early because shipping always is a bit slower around the holidays, and you don't want to get stuck without your medication, so order early. So we really try to be patient focused in everything that we do. So we do have some preferred partner programs for our clinics and those that prescribe medications. Um, and so those are advocates as well. So one is tier one, where the clinic pays, and anyone that a clinic sends will fill the prescription immediately and invoice them at the end of the month. We can send it to the clinic. There's no prepayment or anything. And one of the things that a lot of clinics like is that we do savings reports. So if you're in that space and you need to show for grants and such how much you've been able to save, we will provide that for you. We also have customizable forms, and as you can see here, that we do offer a 5% discount on the medications for our partners, our clinic partners. And so that's the only kind of discount that we have is through that program. Then we have access. You have access to a clinic portal, so you can manage the patients and order refills and get reports. And you also can get customized reports and extra discounts. And there's no charge for that. So if anybody wants to be a clinic partner, just reach out to us. And we can get signed up, and it's a simple MOU, memorandum of understanding, that basically says you're not going to resell the medications, etc. Here's a little glimpse. This patient portal is down right now, so we're actually updating it, and so that should be up in a week or a week or two, I think, is what they told us. So that should be coming up soon, but we do have a dedicated team to help all our clinic partners. I just want to tell you about two other programs that we have. We have one's called Serving Those Who Serve Others, and it's a pharmacy benefits program for clinics and companies and nonprofit agencies so that their full-time employees, their part-time employees, and even their volunteers can get access to our program, because we want to be able to support organizations, and we know that it's tough to keep employees today. It's tough, and so if we can help keep employees healthy, then that will help those organizations. So it's a special program that we have, and it doesn't cost anything to those who are involved in it. We do have a program too called Healthy Reentry. Um, about 6 years ago, we found that people getting out of prisons did not have a continuity of care. They came out oftentimes with 30 days of meds, and it wasn't enough time for them to get to a doctor or a clinic and have a continuity of care. So what we did is we created this program to give two 30-day supplies of bridge medications, and that was enough time for someone to get to a doctor and get to a clinic and get their prescription. So we provided here in Missouri over 8,000 people with over 40,000 prescriptions free. That was all grant funded. Now it's written into the RFP for the prisons and the mental health courts. So this program is going on in Wyoming and in New Mexico, a few different places, and it's should expand throughout the country. And if you're kind of working with justice involved individuals, ex-offenders, and you'd like to learn more about this program, please reach out, because it's a really wonderful program, and it helps reduce the recidivism greatly. Over half the people in that pilot program here in Missouri received mental health meds, and it was wonderful, particularly for the probation officers with mental health caseloads and in rural parts of the state, where people would have a lot of barriers getting out of prison in order to get their medication. I encourage you to sign up for our monthly newsletter. In that newsletter, we do provide our free medication list, and that's a rotating list of about 20 medications each month, that we send out to first our providers, and then we send out to all our patients. It's kind of a first come first serve. Luckily, on those medications, but luckily we've been able to keep a pretty consistent supply of many of them. So if you have any questions, please let me know. We appreciate, again, all that the role that you play in helping your loved ones or your clients, the people that you work with, learn about RX Outreach and stay healthy. And I encourage you to join our program, because it really is a wonderful part of this healthcare safety net. We just want to be able to help as much as we can. Thanks.
Bill, thank you so much for the very easy to understand and thorough presentation. I'm so glad that we got such a great turnout for today's presentation, because, as I said, Needy Meds is a very proud partner of RX Outreach, and the thing that always stands out to me is how much you and the rest of the RX Outreach team, Bill, goes above and beyond to first of all, make all of your efforts completely transparent, but making the process of getting involved and seeking assistance from RX Outreach as easy as possible. So thank you for that. So I am seeing a bunch of questions coming in. So, and I just want to make sure, Bill, can you hear me? Am I coming through loud and clear for everybody?
Yes, I can hear you on my end.
Wonderful. Great. Thanks, everybody. So yeah, and I can see, as I said, a number of questions coming in, and as the audience knows, we do our best to get to as many as possible. Before we get to those, I want to remind everybody also that Needy Meds is here as a source of support if you are having trouble affording your medications and other healthcare costs. So all of these bullet points popping up on the screen now are all different categories of ways to save on your medications and other healthcare costs. They can be found under that healthcare savings tab on needymeds.org. You can always reach out to one of our call center counselors at 1-800-503 6897. And if you'd like to learn more about these programs, please check out our calendar of events for an upcoming overview webinar. We do our best to hold those at least once a month. We also pepper our calendar events with quick briefs that do a deep dive into specific healthcare savings resources. So again, check out that calendar of events on the bottom right hand of our homepage, or click on that education tab right next to that healthcare savings tab to find upcoming webinars. A reminder that if you do have questions for anything Bill has covered or questions about Needy Meds, you can type them into either that question section. For some of you, it may be the chat section of your GoToWebinar control panel. And as promised, I want to leave up the contact information for RX Outreach. That's in the middle of your screen. And if you'd like to reach out to me, my email address is at the bottom of the screen with the rest of the Needy Meds contact information. So I'm going to get to those questions. And Bill, some of these came in the very beginning of your presentation. So it's clear that you actually did address them a little bit later on. But I'd like to ask you anyway, because it gives you an opportunity to drive home what I think are some really important points. A good example of a question that came in early on is, can I use RX Outreach if I actually already have insurance?
Yeah, that's a pretty common question we get. Absolutely. We don't accept the insurance, but there's no penalty whatsoever for somebody to get it. I worked at RX Outreach for 4 years before I got my own mom to join us, and because she was worried about that same thing, she was also concerned about safety of medications going through the mail, and it hasn't been an issue. Everything is tracked and everything, but there's no penalty whatsoever if somebody has insurance.
Great question. Another one that came in, how much does RX Outreach cost?
Sure. There's no hidden fees at RX Outreach, so the price of the medication is um, all that somebody has pays. So we only have, there's shipping is included, the kind of administrative costs, all that's kind of included in. So there's no hidden fees whatsoever, and the shipping is standard shipping. If somebody wants it expedited, there is a charge, an upcharge for that, but there's no other fees.
It's so funny, Bill. I'm sure you get that question over and over because, like myself, I feel like as soon as I see the word free or as soon as I see anything that implies there's no charge, I automatically think, okay, sure there isn't. Tell me what I'm missing. So I'm sure that that's a question you have to answer repeatedly. Yep.
Sure. Well, and to one of the things is the price on the website. We want to make it clear to everybody. I know for me, I was at a retail store, and I found out that this medication I needed wasn't on my insurance, and it was going to be $70. And I thought, okay, hold on a second. I took a step aside, and luckily I knew how to kind of use GoodRx, which I could find that it was the exact same medication was $7, just one stoplight away. And so, we like to keep our prices there so there's no surprises. I did introduce GoodRx, and a lot of people ask us about that, why we aren't on it. So I don't know if that was one of the questions, but we,
It
quite
is.
frankly,
I'm so
is
glad.
it?
I'm so
Okay.
glad you brought that up because I think, Bill, correct me if I'm wrong. We get this in almost every webinar you do, and the question is, why isn't or is RX Outreach on GoodRx, or we get why isn't RX Outreach on GoodRx?
Yeah, we would love to be on GoodRx. Unfortunately, we can't afford it. It costs money, and we keep our prices as low as possible. When I started at RX Outreach, I actually started in fundraising and grant writing, and I remember asking my boss. I said, "Why don't we just add $1 to every prescription, and then we wouldn't need to do fundraising, et cetera, et cetera." And she said to me, "You need to get on the phones and just start, and start talking to our patients and finding out exactly how cost prohibitive it is. And I learned, I was in on some of the phone calls then, and I'd hear stories from people that said, if I didn't get my arthritis medication from you guys, I couldn't take care of my husband. If I couldn't take care of my husband, he'd need to move into a home. I need to move into a home. Like, you keep us in our home, and it's all because they got the medication from us. And we know people have to choose between their medications and their food and these other expenses. And we just want to do everything we can not to. So that's why we keep it as low as possible. That's why we depend on our patients and others like you, Carla, to help us kind of get the word out there.
Thanks, Bill. And I'm so glad. I was actually going to share that story of, or ask you to share that story about early days of you at RX Outreach and why it seemed like a no-brainer to just pass along what seemed like a very nominal amount, and why RX Outreach as an organization will not do that, that you adhere to that really important foundation of, we will not pass along any cost to the patients if it can be avoided. And I think that's really important. And I really like that, um, that story, because it shows you how eye opening it is, and also how much RX Outreach is passionate about their mission. Thank you for that. And you did address this, but an opportunity again to go over this a little bit. Where does RX Outreach get their medications from? And can you explain again how you know that, and how you can assure patients that the medications RX Outreach is supplying are actually safe?
Sure. Yes, we buy about 85% of our medications and get 15% donated by pharmaceutical companies. So we have to kind of work really hard for those. So we are part of this healthcare safety net, and because it's so highly regulated, we know where every single medication has been, where it was manufactured. And so it's safe. That's how we've been in existence for 12 years. Is because we help protect that supply chain, and we never kind of buy short dated stuff, expired medications. We kind of keep it on the up and up, so it's as effective, so it's completely effective for our patients.
That's fantastic. And one of the things I've learned personally from partnering with RX Outreach is, if you have a question like that, not only should you feel comfortable asking it, but whoever you're asking should have a very transparent, ready answer for you. Wouldn't you agree, Bill? And if there's hesitation about answering that, you might ask yourself whether or not it's a reliable source.
Absolutely. One of the things we've seen during, the pandemic, there's a lot of organizations that have popped up, and we actually have a lot that want to partner with us, that are, a telehealth company that's, and really vet them, because again, we want to make sure that we always help protect our patients, and give them the best, and etc. So, but there's I hate to sound negative, but there are a lot of not upstanding players out there. So
It's
it's
true.
really
There are a lot of bad actors out there, and there's a lot of organizations or people under the guise of organization with nefarious intent, no doubt. And with that, actually, I will just take a moment to really stress to check out our calendar of events for webinars. We do, in addition to scheduling presentations that are about healthcare savings, we also have presentations that are diagnosis related, and we also have webinars around the theme of being a well informed consumer in the healthcare field, as well as ways to go about being an empowered patient. And the reason I mention that is because we just touched upon making sure you feel comfortable and empowered to ask any questions that you feel are important to you, your patients, your loved ones, your clients. That's really important. Also, since we touched upon this, we also are proud partners of the Partnership for Safe Medicine, and they do an enormous amount of work through tracking down counterfeiters for both generic and name brand medication. And unfortunately, those are all over the place. And so check out Partnership for Safe Medicine and look at our calendar of events because we do our best to get them to host webinars for us as well. Well, as I said, we do our best to keep the question segment brief. We didn't get to everybody's question, but as I said, you will hear from us via email. However, if you need your question answered right away, don't hesitate to reach out to RX Outreach directly. You can visit the website, drop them an email, or reach out to their toll free helpline, which is 1 888 796 1234. You can, of course, drop me an email at Carla with a C at needymeds.org. Our website and toll free helpline are at the bottom of that screen, and we do encourage you to sign up for future webinars. With that, I want to offer a big thank you to my friend and colleague Bill for another great presentation for Needy Meds users. We love that he's regularly returning to offer his expertise and his passion for RX outreach that does such a great job helping so many that need it. And thank you to our audience. We know you all have busy lives, and we appreciate your taking time out of your day to join us to learn a little bit more about Needy Meds and the partnerships that we have to help you get through your healthcare journey. Thanks so much, everyone, and have a wonderful, happy, and healthy rest of the day. Take good care. Bye.